All right, well, welcome everybody to another webinar with us here at MedSchool Mentor. My name is Ankush Chandra. I'm the Chief Academic Officer. I'm also a PGY5 Neurosurgery resident here at UT Houston. Today, we're going to have three panelists, Jun, Matthew, and Carly. And with us, our guest today is Dr. Langer. Dr. David Langer, he doesn't really need an introduction, but I'm going to try my best to do justice over here. Um, Dr. Langer, he is the chair of neurosurgery at Lenox Hill Hospital. He's also the vice president of neurosurgery for Northwell Health in the Western region. He is also a professor of neurosurgery and radiology at the Zucker School of Medicine at Hofstra. He's renowned internationally and is leading expert in cerebrovascular and skull-based neurosurgery. He's one of the few surgeons that performs a good number of cerebral bypass surgeries here in the United States, and he's made a lasting impact in the field of vascular neurosurgery. Uh, his impact doesn't stop in the OR. He's also a pioneer in digital health innovation. He is a co-founder of Playback Health, which is a platform designed to enhance communication between providers and patients using multimedia medical reports. And more popularly and more recently, you probably know Dr. Langer from the hit Netflix docuseries Lenox Hill and Emergency in New York City, where millions of viewers got a rare but honest and moving glimpse into the lives of physicians, of Dr. Langer, and the realities of modern medicine. And for the many students and trainees here in our audience today, Dr. Langer's dedication to education, mentorship is especially meaningful. Through his Brain Turns program, he provided virtual shadowing opportunities to countless aspiring medical professionals across the globe, making mentorship and inspiration more accessible than ever. Today in our webinar, what we hope to explore is to go beyond the titles, the accolades for Dr. Langer, but we really want to understand Dr. Langer's journey. Dr. Langer as a leader, the mentor, and the person behind the breakthroughs. How Dr. Langer thinks about leadership, growth, mentorship, and what it means to truly make an impact in medicine. Dr. Langer, thank you for joining us. And I'm going to pass it on to Matthew, who's going to start this session.
Thanks, Ankush.
It's a great honor to have you with us today, Dr. Langer. We've actually met during last year CNS in Houston during your lecture. And I would like to begin this webinar by inviting you to take a few steps back and reflect on the past, before the Dr. Langer era. Can you tell us what David Langer was like in college and in med school?
I have to try to remember. I'm more or less the same. I think one of the amazing things is I see you guys. It's not going to be that far where you're going to be just like me. We're all the same. I don't think I've really changed all that much. I've become a little more. I think I've been more comfortable with understanding myself and learning about the way I think and being more comfortable showing vulnerability, things like that. But I think I'm the same person that I was. There certainly the failures and some of the disasters that have happened to me have affected me pretty deeply. I'm not going to lie to you, but I think ultimately I've just kind of always wanted to do something good. I wanted to do the right thing, and to a fault, I can't say that it's always works in your favor, but I always could sleep at night. But essentially, that's really it. I mean, I was always interested in doing something hard. I didn't mind being challenged. I didn't consider, which I think probably I should have, but I really didn't consider quality of life or lifestyle things when I was choosing what to do, which I think is a mistake. I do think that you should be able to have a fulfilling career and be able to balance that with, where you live, what you like to do. I really didn't consider geography at all. I sort of more or less wanted to be as close to my family and didn't think about other things. But the truth is when you're 20 in your 20s, you can't really go back. The experience I had, it's not fair to apply my knowledge now to the way I was thinking then. But if people ask me for advice, I'm certainly willing to put myself with my experience now into that position and at least whatever it's worth, give young people an idea of what I might have done had I had that option. But in the end, I think I haven't changed all that much, and I think that's. Uh, I don't think we change. What probably changes is just the way we filter information, the way we interpret the outside world, and how our voice talks to ourselves, and that's the challenge of learning how to manage that voice and learning how to be as kind to yourself as possible. So,
And to follow up the question, was becoming a neurosurgeon and a leader always the goal? Can you tell us about how did that happen? And
neurosurgeon, yes and no. I remember when I was in high school, I thought about it, or maybe even in college, and one of my close older mentors told me he was already a resident. He said I was crazy to do that. Neurosurgery's got through such an evolution in the last, say, 30 years, maybe 40, and I started my residency in 1993. So talking 30 years ago. I'd say the prior 20 years was really evolutionary. I mean, I had MRI already, I had CAT scan, I had early navigation, early functional epilepsy. These things were in their nascent era. Spine was beginning to become more important in neurosurgery back then. But if you go 10 or 20 years before me, the field was a mess. I mean, patients were dying. You couldn't do anything for most of the situations. No one had a prophylactic operation. All surgery was based on clinical deterioration or clinical exam. There was no, prophylactic surgery at all, which is essentially the vast majority of our business now. And a lot less was expected back then. We're asked, the demands on us are much different because of the expectation of a good outcome. Whereas, 40, 50 years ago, there was an expectation of a bad outcome. So it took some of the pressure off. I do think that the fear and some of the probably extraordinary courage that these obviously mostly men had back, in the 1970s, 80s for that matter, and earlier, or was extraordinary. Now we're protected a bit by the technology and, some of the crazy things we used to do, we don't do. And so the personalities that are in our business are a little bit more normal. Obviously we have a lot more women, have a lot more people that might have gone into more empathetic fields. And you can be an empath as a neurosurgeon now, whereas before, there's no way you could feel someone's pain. I can't imagine. And what the situation these guys were putting themselves in was just, mind-boggling. Um, so, in medical school, I kind of thought I was going to be a cardiologist, cardiac surgeon for a while. And then my father had a stroke, and I was always interested in neuroscience because of that, or neurology. And it sort of morphed. I really didn't want to do internal medicine. I wanted to be a surgeon. And then the cardiac surgeons, I was really concerned about the coming world of stents. And instead, I chose to be a vascular neurosurgeon and got my ass kicked by stents. So that's the whole thing is you kind of never know what's in store. You just have to do the best you can do.
thank you for answering, Dr. Langer. I'm gonna pass the to John, our CEO, and he will ask you
As
the
far as
next question.
leadership, no, I never had designs on being a chairman. I mean, just your ego thinks about it. I think I thought about it just from, it wasn't like really deep in me, like I had to do that. And part of it, I just wanted to be the best surgeon I could be. I was just really interested in being a great surgeon. And retrospectively, I probably should have considered that more. It was only because I had a series of mediocre leaders and people that really didn't know what they were doing that I recognized that I could feel like I could do a better job by being kind of more of a human being and more giving and more sensitive and more unselfish. That I think that I talk about this, that the factors that lead one to become a chair of it or a leader in neurosurgery are just the opposite of what makes you a good leader, because we're so personally driven and ambitious for ourselves that when we finally are given a big title, it's hard to suddenly shift gears and say, oh, now I'm going to be really caring about everybody else. It doesn't work. So if you aren't considering those things along the way, I think if you may get there, but you're certainly not going to be a great leader. And I kind of, when I came to Lenox, it was more or less bailing out of working on Long Island. I lived in New York City, and I went to North Shore Hospital, which is in Manhasset. I just found the environment to be really challenging for me for a variety of reasons, and I missed the kind of culture of being a physician in New York City rather than Long Island. I was reverse commuting, and I just took this wing shot at, starting a department from scratch, which was frankly insane. But it worked out for a variety of reasons. I'm not going to lie to you. There are some days I wished I'd done things differently. But one of the challenges in our lives is to not allow our voice and our to have regret, and you can't do anything about it. You're only living in the moment. It really doesn't matter, and you have to work hard at avoiding that kind of mind game on yourself. And so that's something I pretty much do every day. There's not a day that goes by where I don't have to sort of get my mind around things, because we're dealing with challenges big and small that affect our ability to kind of be joyful. And I think it's our responsibility to control that inside our head every day.
Good afternoon. Can everyone hear me?
Yeah.
Okay, so at Med School Mentor, we believe that mentorship is a cornerstone of growth in medicine and academia. So looking back on your journey, was there a mentor who truly shaped your path? We'd love to hear about that relationship, how it began, what made it impactful.
Remember, mentor is a two-way thing. You have to choose the right mentor. The mentors aren't necessarily looking to be mentors. You have to find. I just didn't do a very good job of. I could do a whole psychoanalysis on why, but that's irrelevant. I didn't choose good mentors. I made some decisions that were a little bit. My best mentor was early on was Kate Carrico, who was a great mentor, who I unfortunately left. My next mentor was my boss, Gene Flam, who trained me in neurosurgery. He was not a great mentor. He was great when I was a resident, but once I moved to New York with him, it was challenging for a variety of reasons. He's a wonderful guy, but we were put into a tough situation. We were ultimately both had to do what was best for ourselves. And then further on, I had other mentors that were, I wouldn't call them great mentors, but luckily I met a guy named Nick Hopkins, who unfortunately passed away this year, and he never taught me anything. He never, crossed paths with him as a resident, but I met him at meetings, and he was kind enough to let me train interventional. 10 years after my residency, I did a fellowship with Nick and his team in Buffalo, and after that, I've always respected him and his way of life and his way of treating people and his success. And he was the one I went to when I was really struggling personally about how to be a leader and how to construct a department, how to find a way to influence people, and not worry about yourself as much. And he was the one who really, I went up to him, stayed overnight at his house, and we spent a dinner together, and it was an extraordinary night. And I think to me, that was the tipping point for me, if I had to choose one person one time. But I regret not having better mentors. To this day, I don't really have that type of person in my life, other than maybe some family friends. In neurosurgery now, Fatty Charbel, I would argue, is my biggest mentor, although he's really my best friend. Jacques Morcos in Houston, and Paul Camerata in Kansas. I think those are the three people who I rely upon the most for guidance, whether it's personal or professional. And it's important you have those relationships for sure. You should have them now. But I think and then Johnny Bookvar, who you've already interviewed, John and I are very, very close. I wouldn't call him a mentor. We're more best friends and have a very, very unique, deep relationship. So those are the people that influence me the most.
Yeah, thank you very much. Along those lines, what advice do you have for med students or residents? How should they look for the right mentor? I know it's a lot of sometimes hidden trial, but what advice do you have?
Well, I think the most important thing is you get to know somebody, or they let you in, that they're not robotic, and that they're willing to, they have time for you. There are some key things, like, is it really hard to make an appointment to see them? Like, if I call their secretary, are they willing to sit down with me? Or if they are, is it when you meet with them, are they hassled and seem preoccupied, or are they live in the moment and really dialed in on you as a person, even though they don't know you? I think those are the things to look for. If somebody's, not available or seems, don't just go after somebody because of who they are and their name. The last thing you need is some famous person that, you're meeting, and then you feel good about yourself and you can ask them for a letter of recommendation, when they really don't add anything at all to your kind of growth. And so there's some risk there. I mean, ultimately, it's not no good answer. You have to trust your heart and your mind, but you have to know what you're looking for. You're looking for somebody who's really going to take an interest in your success and help you by not just opening doors, but by giving you an opportunity to be vulnerable and to ask those types of questions, and to give you some solutions, rather than just meet with you and tell you what you want to hear, tell you how great you are. But this is it's an inexact science, and very often the best way to tell is other people talk about those folks, like this person's a really wonderful woman or a really wonderful guy, and they have a track record. That unfortunately, or for better or worse, a lot of times it could be someone who looks like you. I think women are very often feel better with a female mentor. Not that there can't be good male mentors for women, but then we're seeing more and more of them. And 10, 15 years ago, there weren't very many in neurosurgery, but today there are. And if if you have brown skin, or you have, you don't look like me, it's nice to find other people that have a similar background. It doesn't mean it's not a racial thing. It's just there's a certain common understanding of your issues that come up. If you're an immigrant, if you're, if English isn't your first language, if you're the first person in your family to go to college or medical school, these things, it's hard for me to understand that what it's like to go through that. Now I do enjoy being a mentor, and by the same token, there's some people that I really resonate with, that ultimately I feel like I've been really impactful with, and other people who choose to work with other people who I don't resonate as with. Why? That's maybe I just having a bad day. I'm not, maybe my antidepressant wasn't working well enough. I don't know. But the truth is that you just have to be as kind of creative about it as possible, and you'll know when you find that person, because they make you feel good, and they make you better at what you do, and that's the goal.
Oh, no, thank you so much. I think one follow-up to that is, a lot of times we have students who are not able to connect within their med schools or in their departments of interest with any physician, any resident. What advice do you have for them to reaching out to seek mentorship at other institutions? I'm sure you probably get a lot of emails, and I'm sure you have mentors that are not at Northwell, or maybe not even New York City for that matter. I think that's one of the recurring themes we're noticing with some of our students.
I could tell you that where there's a will, there's a way. If you're willing to do the work and show up, and it's one thing to ask for help. It's another thing to show up and knock on your door, or actually do something. Nothing. I mean, very often your reputation is with these types of folks is based on you actually doing something. Sometimes just dumb luck. I mean, I remember he wasn't really my mentor, but when I was an intern in general surgery, there's a guy named Larry Kaiser who ended up becoming the chairman of the department, who was a thoracic surgeon who had just gotten to Penn about a month before. And I was asked to go see a patient of his. I was an intern then. We used to do a rotation on cardiothoracic surgery. So I was on the service, and but I'm a neurosurgery, but I'm not on neurosurgery. So that's the way the internships used to work. And I went to see his patients who'd been vomiting, who was admitted into Larry's service, and Larry wanted a GI consult. So I went to see the patient, and the guy's had been vomiting and was grossly ataxic. And who else does a neurological exam other than a neurosurgery intern? So the guy's like, he had his finger to nose testing was all over the place. And so I said, I told my cardiac surgery fellow, I go, Katso, I was like, I don't think you need a GI consult. I think you need a CAT scan. And he was like, what? I said, just get the GI. I'm telling you, he probably has a cerebellar tumor. And lo and behold, they got a CAT scan. There was a cerebellar tumor, and freaking Kaiser comes and gives me a big hug. You're amazing. You're just doing your job. And I think ultimately those are you have very few chances sometimes. that's why you just have to just be the best you can be every day. You never know when those opportunities come up. And, I think the secret to success in some ways is not to be looking for, validation, or not to be needing to hold told how great you are. You just go and doing your job. So few people just do their jobs, and they're looking for, some sort of feedback, or looking for to be told how great. I need, can I write a paper for you? Yeah, you can write a paper for me. Go write the paper. Then we'll talk about it. It's like you'd be surprised at how sort of small things can lead to in a big way. And that's why relationships are based on contact. They're based on collisions. And yeah, maybe it is hard if you don't have somebody in your local network that you can meet and work with. Then you have to find that person. That may mean disrupting your life. It might mean getting off your ass and moving somewhere temporarily if that's what you really want to do. But nothing beats just the ordinary day of just showing up and doing the right thing and being known for that, and not necessarily being obsequious and a kiss ass. Just be yourself, do what you're supposed to do, and it tends to work. And I think that's the best advice. I mean, I'm happy. We're one of the reasons why Brain Church is so successful is because, we're able to provide at least a modicum of that virtually, but we have like a lot of face-to-face interns every summer. And, it's the minority that really break through with us, and that because it's more than just coming and watching. It's, you can tell when a student's really motivated by their behavior. We're not, you can really tell immediately I'd say within a few meetings of what the quality of that, and we obviously gravitate towards those people. And, that's the best advice I can give you. It's just, you do the work and you don't complain, and you do the right thing, and you do the straightforward things well. You're going to be successful in general. Yeah.
Thank you so much, Dr. Langer. It's a pleasure to have you here. I just want to ask you, throughout your career, you have emphasized the importance of empathy in neurosurgery, not just like technical excellence. In your opinion, what specific habits or practice can young doctors adapt early on to preserve their humanity while operating in such a high-pressure, perfection-driven specialty?
But I think that has a lot to do with fixing yourself first. If you're worried about what people think of you and are, which we all do to a degree, if you're worried about the outcome, or too driven selfishly for, if you're focused on things that are not related to what you can control, I would say, it does take away from what's right in front of you, which is the patient. I mean, empathy is tough to teach. You either have it or you don't. I mean, I don't necessarily think that you can like learn to be empathetic. I mean, there's probably, you can take courses, but you have to, if you have to remind yourself to feel what another person is feeling, then it's not probably going to be automatic, and it's probably going to be hard for you to use that on a consistent basis. So I would say you either have it or you don't. I think some of it can be learned. Sympathy is obviously different than empathy. You could be sympathetic, feel badly that person's going through something, but to really feel what it's like to be the patient is something that you've got to try to do. I think because it helps you to communicate with them, to understand their view, and not to be surprised by the questions they asked, or even anticipate what some of their issues might be. And that allows you to, act differently, and sort of be, more forward thinking about what the behaviors that can help that person. The unfortunate fact is that your success as a surgeon probably doesn't matter too much about that. I always tell the story that if you had one surgeon that was super empathetic and gave you their cell phone and was always available, and they were 90% effective, and you had another person who was a complete jerk and never saw you and never talked to you, but was 100% effective, you'd go to the 100% effective guy. That's just human nature. You have one shot to treat your cancer or your aneurysm. You're gonna go to the 100% guy. Now, we don't have great outcome measures to know who that 100% guy is, but there are so many factors that go into why people come to you that have nothing to do with empathy. And so empathy is really for you. It's inherent in why we became physicians. And if you don't have that and don't experience that, I don't think you're going to enjoy your career as much. Because, I mean, frankly, I seeing someone do well and experiencing pain and suffering and bringing them through that is an extraordinary opportunity. And if that doesn't make you happy and doesn't give you joy, then it's hard to really enjoy your career. It's not all about the surgeries. And so you're basically hurting yourself. I could have made more money doing something else, or could have done other things along the way to ensure that I was busier surgically. But I've chosen to do it this way because not only do I have empathy for my patients, but my partners and the people that I serve as their chair, and try to be valuable to them, whether they're my partners, our fellows, our residents, our medical students. And I get a lot of great feedback from that behavior. It's selfish. It's what I like to do. I mean, when I'm asked to do this thing, I mean, I don't have to do this. I enjoy, influencing young people. It's part of my way of my DNA. So it's more than just the patient care that you have to have this if you need it. Some people don't need it. So I think you'll just experience your career differently.
Thank you.
Dr. Langer, you've reached people all over the world through the Netflix series. And I remember you mentioned it that you watched with your daughter. Actually, I watched with my grandmother during my first med school year. And she was 80 back then. And she completely connected with you and with Dr. Bukvar. And it's amazing how you were able to impact people of all ages. And just like Neil Armstrong was your role model growing up, now Dr. Langer has become a role model for many aspiring physicians and neurosurgeons. How do you feel about carrying that kind of influence? Does it feel heavy on your shoulders sometimes? And as a leader, what core values do you hope to reflect on those who you inspire?
Well, when I was watching that with my daughter, she started to cry because she said, "Dad, I think there was one episode where I got a little upset, at somebody, or, I was sometimes you lose your temper. It's just, and I'm at home, I'm like, I never lose my temper at all. I'm like, I'm like a salamander at home or something." And I said, Molly, she was used to watching like Grey's Anatomy. I think she had a view on me that was sort of idealistic, like that's my dad. And she had this perfect view of me that was sort of disrupted. And she was crying. I said, Molly, that this is the real world. This is, it's not all Grey's Anatomy all the time. And it was very edifying for me. Certainly it wasn't my intent to upset my daughter, but the way the world sees you is very different than the way you see yourself. And it's the trouble is that if you worry about what other people are thinking of you, if you can't, you have to really work hard not to do that. There's also I don't know if I'm very into Stoic philosophy. There's the component of Stoicism about not needing the third thing. So you do the right thing, and then you accept the outcome, whatever that is. But you can't. The third thing is being recognized, and being. You don't need the third thing. The third thing's unimportant. It's not a reflection of anything going forward. If you are, it's great. I'm indifferent to it. On the other hand, if I had a choice of being known in our business as the best bypass surgeon or being this person that people think I am, I'd much rather have the latter. First of all, it's much harder to do. And I think it's more along the lines of my personality that I've learned so much about myself along the way that to be able to, even if it helps one person to, develop a better way of managing themselves, that's a great thing, because I didn't have that when I was your age. I don't think I never met a doctor that talked like this. There was no one who was willing to, show themselves or show vulnerability, or be able to say, that this is the way I think and it's not good. That just didn't happen. And I do revel in that a little bit because I'm comfortable with myself, and I know that it doesn't mean I'm perfect. You know, I'm flawed like everybody else. I have strengths, I have weaknesses. There are things I do that I could do better. But I'm not afraid to admit that. And so in the answer to your question, I really feel humbled by the whole thing. You know, the Netflix thing was really a just total luck. You know, you make your own luck by being open to things and being kind of creative and not willing to take risk and, you know, do that extra meeting or make that extra effort. So there's no question that some of the success has to do with me and John for that matter. But I also think that the experience of this is very different and the benefits are very different than what I thought it was going to be. And I think this is the biggest one. And to really be thought of as Neil Armstrong, I mean, come on. So,
And that's a good thing for you to say, because you were actually the first great physician that showed me this side, you know, this emotional side. So I think this is a really good thing that you do, and you really impact a lot of us young med students and aspiring future doctors to be like that, and that's very important.
well, I also think that, you know, we have to be human, and the recognition of that is important too, because I don't think you're ever gonna be as happy, especially going forward the way medicine's changed. You have to find your own path and find your own happiness. It's not just gonna be dropped on you. And you know, just because you're smart and hardworking and talented, you know, you in order to really get the most out of this business, you have to find a way to derive gratification from taking care of patients. And actually, in some ways, my greatest gratification is our group, you know, the physicians that I work with. You know, patient care can be rough, you know, and again, patients don't always appreciate everything you do. And then it's often in neurosurgery, especially, it's not like you take care of them their whole lives. It's usually a single, you know, time. So you get a few weeks of these people and their family, and then you move on to the next one. And so these extended relationships are rare with patients. But I think that the relationship I have with John and with the rest of our faculty are really amazing. And that's, I think, comes from the same place. And I appreciate that you all see that. And I hopefully not only will you take that with you as a physician, but the way you choose your job, the way you choose your partner, the way you choose, you know, what kind of doctor you want to be and why. That this kind of understanding of your emotions and your motivations informs you so that, look, I made some mistakes, you know, and had I been more practical and a little bit more aware of my emotions, I think I probably would have made different decisions, but I wasn't. And I never thought about it. So if that's happening to y'all, that's good on you. And the fact that you recognize that is also good on you. It has nothing to do with me. I mean, you have to be open to those things and be willing to recognize the value that brings to yourself. And that's really important in order to benefit from it.
So we have
Dr.
a
Langer.
question from the audience here. Amir Samson, he asked you, what qualities do you see and like in a student who works with you? And he's asking about a certain charm or quality you've witnessed and felt, both on the outside and on the inside.
Yeah, I think that the whole thing is honesty and being real, you know, and just being yourself. I mean, unfortunately, when people come, they feel like they're auditioning, or they've got this one chance to prove how smart they are, and you know, being kind of real and having emotional honesty and those are the most important things. Being confident, being willing to ask questions, but also being willing not to ask questions, being to say I don't know, that if I ask you a question you don't know, don't get upset. I mean, you can't learn if you know everything. You don't need me. Be willing to admit that, and that goes all the way through your training. You can't learn if you knew the answer, then that they didn't learn anything. So if you don't know the answer, that's good. I don't know, and you go on, you learn. Next time you get asked the question, you'll know it. I also think just the seeing someone who really gets it, who just shows up and, like I said, just does without being asked, just figures out a way to be valuable. And those are things, and at least on first thought, that really stand out. But I think just being yourself, being real and being authentic, and not trying to impress or make me feel like you're somebody other than you. And that you have to be comfortable with yourself, and you have to be comfortable being uncomfortable and not letting it show so much. Or if it does, you say, "Hey, I'm really struggling today. What do you have any advice for that?" It's okay to say you're not feeling great. I mean, one of the stories I give is I remember going to the national neurosurgery meetings when I was young, as a resident, and then as a young attending. I was so, oh my God, there's this guy, there's that guy, and you feel so small and insignificant. And the truth is everybody feels that way. And then all the real big, big name guys with a lot of badges on there, forget it. It's just, what are you doing? If you need to be on the podium, great. That's if you need to be the attention, it's fine. I don't have any, it doesn't matter to me. And just remember that all these people that have all these names and badges, they may not be as confident as and committed as they may seem. That remember, there's a certain transactional nature to this world, and sometimes you have to, asking to be doing something. Let me do that. I'll invite you. You invite me. It's a bar. The success is in the eyes of the beholder, and just remember, you're a good person, and you're very valuable, and it's fine to be respectful of people who've been really successful, but don't feel too insecure and overwhelmed by all that. It's just it does require some effort to turn your mind off and say, you should feel confident going up to somebody and introducing yourself, and not be there because they're human just like you, and they were in exactly the same position you were just a few years ago. And if they don't have time for you or they turn their back on you, screw them. That's just inappropriate. And I think you have to try to remember that.
Dr. Langer, you juggle a wide range of responsibility and stress, like caring for patients, father and husband, and leading a department. I'm sure that stress is a lot and sometimes hard to manage. How do you ensure that it doesn't affect the way you show up to others, both at work and at home?
It does. It does. I think that my kids know that that I try my best. I'm not perfect. But I also think that a lot of that's in our own heads. And so I think it has to do with talking to your children about it and making sure they're aware that you're thinking of them and that you do care about that. And that if it doesn't always come out right, it's at least they are aware of why. And again, I think that there's an element of that your kids are amazingly perceptive. They're going to see how you treat other people and themselves. They're going to see, what you say about other people and the way you manage conflict or problems and stress. And I think that they are influenced as much by what you're not aware of as much by what you are. You're just spending more time with them and taking them on trips and stuff. That's not really, I don't think it has as much of an impact as kind of your daily life and the way you live your life and the way you prosecute your life. And I believe that. I of course, looking back, wished I'd spent more time with them. But the truth is, in order to do this business well, there is a certain level of sacrifice that has to be made, and especially when you do what I did, which was make some questionable decisions about what hospital to work in, and then doing a mid-career fellowship, and then going to Long Island. It was like, what am I doing? So I had to, crawl out of that and make some additional moves that weren't necessarily the best for these extra amount of time with my kids. So that's, I think, you're only human. If you're not happy at work and happy with what you're doing, you're not going to be a great parent anyway. So just because you're busy shouldn't take away from the lessons that your kids learn from you. As far as your significant other, I'm not necessarily the best one to talk about that. I mean, I think that I've been divorced once. My current wife and I have had significant, but that was really a lot of it had to do with my own injury and her illness, and there were some things that have happened with that. But I think that the key for having your spouse, your significant other, is that they recognize the how much your career makes you happy and are comfortable with that. If they're competing for you with your career, it's a bad thing. And so in order to have a good relationship, in addition to all the things that a marriage counselor might tell you, which is vulnerability and look at the other perspective, and you can't win arguments, and you have to try to, you can't be selfish. The truth is that if they don't inherently understand how hard you're working and why, and that your career is about not just about how much money you're making, but that it's what makes you happy, that it's part of what makes you the person you are, and to do as best you can not to take away from that. I think that's really the number one thing that has to happen, because this is a tough business. It's not for everybody, and if you choose to do it, then you're doing it because it's what you can't imagine doing anything else, and you're willing to give up that time because it's what makes you happy. And your significant other has to understand that. And I think it takes work. It doesn't mean you should be oblivious to the small things. The other problem is, being famous and all this stuff, it really doesn't help anything. This life's all impermanent. It doesn't get you anything. It's fun. I mean, I think there are aspects to it that I enjoy, and there are some neurosurgeons that are much more famous than I am that are getting to fly over the world and, be on these committees and run around, having power or influence. I don't really regret not doing those things. But I think that you just have to recognize at some point you may have to make a choice between, being there for your children or for your significant other versus, flying off to some meeting or give some talk. And you have to learn to say no and have a boundary. And that's something you have to learn along the way. And these are all things you have to really think about. There's no such thing as a balanced life. It's you want to be happy with yourself and with your career. It just depends on how much you need and how much you're taking away from the other influences in order to get that.
So following up that line, we have a question from Madison. She's actually a pre-med at University of Michigan, and she asks, Dr. Langer, with everything you balance, surgery, leadership, innovation, mentorship, what mindset or philosophy grounds you day to day? Is there one belief or habit that's made the biggest difference in how you lead both your life and your team?
Yeah, so I became really influenced by Stoic philosophy starting about 5 years ago, and I also meditate every day for about the past 2 years. I think that that's helped me a lot. I think there are two things I think about every day. One is that comparison is a thief of joy, that I don't compare myself to anybody else. It's just worthless. Yeah, there are going to be people who are more accomplished that do things better than me, and it makes no difference to my success about whether somebody else is successful or not. In fact, there's a concept called mudita, it's a Sanskrit word, which means it's the opposite of jealousy. It's being happy for someone else's success. And I think if you can feel the comparison, the thief of joy, and that you have mudita, you solve so many problems as being an ambitious physician, because we get taken down by, oh, that guy did this and what a jerk, he doesn't deserve it, I deserve it, or they get a better job than I did, I can't believe he published that paper, but forget it. So remember that comparison's thief of joy, and the concept of mudita. The other thing I think about is Epictetus who is one of the primary main Stoics. There are four major Stoics, people historically, and he talks about that essentially all of your happiness is in your, your mind is where you live. You live in your own head, and that you can't if we're constantly thinking about what we can't control, and we don't recognize that it's what's in our control, then it's hard to be happy. You have to make sure that you do the things that can affect. That there's the desire is a big problem, and that you have to understand that your impressions of what's really happening are just your own. But events as they happen, but you can't seek to have events happen as you wish, but you just have to wish them to happen as they do. In other words, just have to accept whatever, you just accept that's the way it is. And then you only can control what you can control. And there are decisions you have to make that are sometimes forks in the road. Once you make a decision, it's a commitment, and you can't kind of look back and regret. I mean, I'm not a sage. I have to work on this myself. I have to think back myself and reflect on decisions that I've made, for better or worse. But I try not to let them pull me down. That you have to accept that you're just a human, that you're a good person, and that you're sort of doing the best you can. So it's really comparison's a thief of joy, and not wishing the events to happen other than as they do. And if you can use those two things and meditate on that every day, I think you probably pretty much can solve the majority of things that are going to get you upset. It doesn't mean you're going to have some bad days or be a little off, but when you feel that, you fall back on those kind of primary thoughts, and I think it can really help.
Yeah, no, thank you so much for that. We've all heard your lecture at CNS last year in Houston. One of the things you referenced was that your ultimate success in life is based on your character, and that really resonated with me. I just wanted to see what your thoughts are on that. I know you already touched about some character traits that you believe are important in the journey here, but some more thoughts would be great. Thank you.
Well, I'll give you a typical example. Last week, one of my partners who's in Long Island had seen a patient for a bypass. I love doing bypasses, and I hadn't done one in a few months. And I got a call from a patient who'd already seen a mirror, and it was signed up for surgery in June. Called me for a second opinion. And I have a pretty big name. If I wanted to, I could say, come on over. I'd be happy to see you. I'd basically listen. I said, you're in good hands. There's no reason that you should come all the way to the city and they wanted to have their surgery on Long Island. I said, you're in good hands. I mean, I'm happy to comment on the decision, to go over the films with you and to review your case. But I think you're in good hands with Dr. Dadashti. And I don't think I would have done that a few years ago. I think that's what I think is character. The truth is that if just the physical act of doing surgery is super fun. I love operating. And we tend to define ourselves by how many cases we've done, and we look at our success by the number. I've done this many aneurysms, or I made this much money, or and I gave this many talks, and I've moved hard away from that. That sure, I do wish I was busier sometimes, and because I've given ground in certain ways, I don't, it's such a competitive business, and the minority of people think that way. So, because I don't put a lot of pressure to force people to come to me or try to, go behind the scenes and, hey, send the patient to me, blah, blah. I don't do that. So I have myself to blame, but I have to be comfortable with that. And I've made that choice, that my character and the way I behave in life is more important to me than doing that extra case. Now, that's me, and I don't know what's in other people's heads. I can't imagine what it's like to be in somebody else's mind. Are they constantly anxious about, they're not, if they're losing a case or this or that, they may be. But again, I can't compare myself to anybody else. I have to live within my own 2 years. And so, I've chosen to do that. And it doesn't make you more money. It doesn't get you more power. It doesn't, result in, any tangible benefit to yourself that's like the typical benefits. But at least I know that I'm doing the right thing to a fault, and then I feel that I'm, on the path that, making loving other people and having that feeling is really what we're on earth for. And I think that that's kind of the way I've chosen to make decisions. And it makes things a little easier to decide. It doesn't always make it easy to deal with the outcome, but then I have to fall back on, hey, I can't worry about the outcome. I have to just, do the right thing and do what I do. And that's why this kind of circular thing happens almost on a daily basis. And I have to be comfortable with that.
Well, thanks so much.
Dr. Langer, in a previous interview, you have spoken about how some students are drawn into neurosurgery, more seduced by the image of it, and often without fully grasping the emotional toll and long-term demands it requires. As a student, I've seen many residents and physicians struggling with depression and anxiety that stem from career choice that were misleading with their expectation. And personally, I recall the tragic case of a neurosurgery resident here in Italy who suicided a few years ago. And this really shocked me and my colleagues. So, in your experience, what are the early signs that someone may be pursuing neurosurgery for the wrong reason? And how can mentor actively help students recognizing this misalignment early on? Thank you.
I think with America, we have these work hour restrictions like Europe has now, and I think that when we used to be exhausted, when you're really tired, and your depression level goes way up, and your threshold to freak out is like zero. So we've really improved, I think, the kind of milieu of mental health in our business just by the work hour restrictions. But there's still a fair amount of abuse just that we put ourselves through. Now, understand that you have to learn how to manage yourself in those situations, because when you're done and you're an attending, you have to be trained how to manage that. So part of and performing despite them, and then realizing what you are capable of doing, and then you improve, you become more emotionally resilient. Look, there's no question that some people choose, especially men, choose neurosurgery because they want to get chicks or make a lot of money. This was something that we still see in America. Women choose their careers a little bit differently. There tend to be, I was at the Nobel Prize with Kate in 2024 or 2023, and the woman who won the Nobel Prize for economics was a economist from Harvard who won the Nobel Prize because she showed that the reason why women make less money over their careers is childbirth. That they choose they choose where to work and the type of job they have based on the fact that you have to carry and birth a child. That is actually a physiological thing that can't be changed. And so women have inherently a different set of issues. And, I don't think our business, we're getting better, but the women's thought process can be different. And so as I'm not a woman, and many of the leaders in neurosurgery remain men, the majority are. And so there are things that come up from a female perspective, and sometimes for men as well, where even though we feel we're really cut out to do this, that sometimes the environment can set us on a crooked path. And so it's not that you shouldn't be doing it. You just have to ask yourself, is it worth it? And it's worth it if it's worth it. As long as you're pure, as long as you choose this specialty for the right reasons, that you just can't imagine doing anything else. I would argue that if you're comparing neurosurgery and anything else, maybe the exception of cardiac surgery, but that's usually not one of the things that, that people compare neurosurgery to, that you're in some ways, look, if you're happy doing ENT or radiology or dermatology or, plastic surgery or minimally invasive general surgery, if you could be as happy doing that, then maybe you're better off, because there is no question that this is tough. But the toughness is important because it's not all roses and lily fields when you're done. It's not like, there's a reason for the training. It's to make you to go from a lay person to someone who's comfortable drilling a hole in somebody's head and, turning a bone flap and dealing with a stroke or bleeding. That is a process. And there are aspects to your training that are going to stress you, make you feel really badly, and are going to be really painful. And it doesn't mean that you're not going to be a good neurosurgeon, you shouldn't do it. But there's a fine line if you haven't chosen, if you're not really into it and feel really motivated to be as best you can be, then you might hedge and you might say, why am I doing this? This is crazy. Because if you aren't motivated for the reason, yeah, if you aren't really into this and really want to do this for the right reasons, this is insane. And it only gets worse when you're done, because then you're actually doing it. And if you're not, don't have the right stuff and don't allow yourself to evolve as a human, you're going to be only worse off from it, because you're going to be doing something with, like, what am I doing this? I should be selling hot dogs in the street. I'd be much happier. So, this is why this decision is so important. The decision to go to medical school is nothing compared to the decision of what kind of doctor you want to be. That's a much, much bigger decision and much more difficult, because there's so much of a difference between people who are doing one sort of specialty than another. And if you choose this, buyer beware. You have to make sure. That's why make sure you spend time with neurosurgeons, that you're, do rotations, and don't just be goo goo gaga about it. Oh my God, it's a subdural. It's so incredible. Whatever. Make sure you look at, are they happy, or would you be happy with, being put through that stress? And you can't be too sort of too emotional about it and too kind of star-eyed. You have to really look at this rationally. And it's hard because it is really cool. I mean, you see some really cool stuff, and it's very attractive. But you really have to ask yourself those deep questions before you decide to do this.
Thank you.
Yeah, we're about to finish. We're just gonna close. Thank you, Dr. Langer, for sharing today not only your journey, but your mindset and your heart and your approach in leading in medicine. Whether you're in the operating room or you're doing your mentorship program like the Brain Turns, I think your commitment to impact is really unmistakable and inspiring to all of us. To everyone here tonight, this is what Leaders in Medicine is about. Hearing from the leaders who are not just excellent clinicians, but transformative forces in healthcare. And tonight, I think Dr. Langer really reminded us why that really matters. So Dr. Langer, on behalf of Medical Mentor and all of us in the audience, thank you so much for your time. Thank you for willingness to do this. And thank you everyone for joining us.
Thank you, guys.
Much. Thank you.
Here,
Thank you, Dr. Langer. It was a pleasure.
guys, take it easy.